Good day, good afternoon, good evening, wherever you are in your part of the world. Hope you are safe and well and have all that you need to survive. This is King B News and Views with another video. We're going to talk about health in this video. And you see the title on the screen, What to Know About POTS, a condition marked by dizziness and fatigue that's often misdiagnosed. This article released by Self, all right, released 3 days ago. About an 8-minute read. We're going to dig into this article and see what we can learn about POTS. Back in 2014, Haley Hudson was a healthy, active 16-year-old. She worked out several days per week and played competitive softball. Despite having Ehlers-Danlos syndrome, or EDS, which caused her to have hypermobility in her joints, I was in the best shape of my life, she tells Self. Around that time, Hudson underwent surgery for a condition. Her first practice back after the operation, things felt off. I was running the bases and couldn't breathe. It felt like my throat was closing up. I was dizzy and had spots in my vision, she recalls. As the season went on, things got more intense. She continued feeling dizzy at practice, but also developed debilitating fatigue once she got home. Hudson was misdiagnosed with anemia, asthma, generalized chronic fatigue, fibromyalgia, and anxiety before learning what was actually happening. She had postural tachycardia syndrome, or POTS, a blood circulation disorder that affects your heart rate when you change positions, like going from sitting to standing. It can happen to anyone, but is way more common in women between 15 and 50. All right. So that's a way to tell. Like it says, you change the positions, like when you're sitting down and you go to stand up, and you feel dizzy. That's interesting. I mean, how many people have experienced that and think it's nothing? POTS isn't rare. About 1 to 3 million people in the U.S. had it in 2019, and it seems to be on the rise, although actual numbers are hard to come by. The cause is unknown, but it can happen suddenly after a major health event like surgery, as in Hudson's case, pregnancy, puberty, or a bacterial or viral infection. That last one is a biggie, given that research suggests some people can develop POTS after COVID, and an estimated 186 million people in the U.S. have been infected with SARS-CoV-2. We have seen a huge uptick in people with this disorder, mostly women. Robert Wilson, a neurologist who leads the Cleveland Clinic's POTS division, tells Self. It can be debilitating. It has no cure, although a combo of lifestyle modifications and medications can help. But all too often, healthcare professionals mistake the symptoms for other issues. Here's everything you need to know about POTS, including how to spot its symptoms and when to seek help. So what is POTS? POTS is an acronym that stands for Postural Orthostatic Tachycardia Syndrome. It messes with your arteries' ability to contract properly, which is known as vascular tone. As a result, these people really cannot maintain blood flow, Dr. Wilson notes. Nikki Bart, MD, PhD, a cardiologist at St. Vincent's Hospital, Sydney, tells Self that POTS can interrupt some bodily functions you can't control, like your heart rate, blood pressure, and body temp. Normally, when you stand up, gravity pulls the blood down to your legs, Dr. Bart explains, and your nervous system senses and corrects for that by getting your blood pumping up to your head. But if you have POTS, that doesn't happen. You might get this pool of blood in your legs and not enough blood to your brain, so you feel lightheaded, dizzy, or have palpitations, she notes. What are the symptoms of POTS? This condition can manifest in subtle ways and masquerade as other conditions. For Hudson, it took 6 years after her first symptoms appeared before she was correctly diagnosed. Here are some things that doctors see. Fainting or dizziness, especially when standing up or staying in one position for a while. Because your body has a hard time moving blood around when you maintain a certain posture for too long or switch things up suddenly, you might feel super dizzy or like you're about to faint. Typically, this feeling will go away once you lie down. Sleep problems. Dr. Wilson says that people with POTS frequently have issues with their sleep. The prolonged horizontal posture can be a problem, and it can lead to insomnia, sleep disturbances, and daytime sleepiness as a result. Fatigue and brain fog. If you have POTS, you may not get dizzy or faint, but you most likely will feel physically and mentally depleted, Dr. Wilson explains. Fatigue has always been my worst symptom, Hudson explains. It affects my daily functioning in so many ways. I struggle to drive and walk through stores or down the street. Unfortunately, Dr. Wilson says this symptom is often overlooked by healthcare providers. If you wait for someone to faint, you're going to miss the diagnosis. You might also have problems processing info in general, aka brain fog. These people often have a mass reduction in their work production. You see a severe impact on their daily function, Dr. Wilson notes. A racing heart or shortness of breath. If your blood pools in your lower extremities, it can't work its way back up quickly when you stand. Your heart, rightfully so, freaks out a bit and works extra hard to get some circulation to your brain. This can result in a heart rate increase of more than 30 beats per minute, or a total heart rate exceeding 120 BPMs within 10 minutes of standing up, per the National Institutes of Health. That's the tachycardia part, which essentially means that your heart is beating way too fast. Palpitations can also happen if you lie down, and you might also feel a sense of breathlessness. A racing heart can also happen at night, which can contribute to your sleep troubles. Feeling anxious. Dr. Wilson points out that POTS is frequently misdiagnosed as anxiety. That's because when you have a racing heartbeat that's paired with fatigue, you become what he calls wired and tired. You feel like you have the flu, but also like you're overcaffeinated. Your blood pressure is dropping. Then the blood overcompensates to fix that, he says. These symptoms can mimic those of anxiety, especially if a doctor can't determine any other causes. Here are a few other common POTS symptoms: increasing sweating, issues with your bowels or nausea and vomiting, skin discoloration, especially bruising on your feet or legs, a sensitivity to heat and having a harder than usual time exercising due to shortness of breath. Diagnosing POTS can be tricky. Since POTS isn't technically life-threatening, if you're fatigued or fainting or having a racing heartbeat, a doc will likely scan you for other, perhaps more immediately dangerous things before considering POTS. During this process, Dr. Barth says it's common for them to examine you for heart disturbances and give you tests to rule out other issues. If they suspect POTS, your doctor, either a primary care physician, neurologist, or cardiologist, may perform something called a tilt table test, where you lie on a literally tilting table while a healthcare provider measures your heart rate and blood pressure. If your readings are abnormal or your symptoms get worse in response to changing positions, there's a chance you have it. They are more likely to diagnose you with POTS if you've been feeling wonky for months, and may order other heart and nervous system tests to confirm it's not something else. Again, no one really knows what causes POTS, but researchers have noticed a connection between having an autoimmune condition like Sjogren's syndrome and developing POTS. In addition, people with connective tissue disorders like Hudson's EDS are also much more likely to develop POTS. It's thought it's thought that anywhere from 40% to 70% of people with hypermobility or EDS have the condition. Dr. Barr says that experts also don't know why people assigned female at birth are more likely to have the syndrome, but there are some theories. The hormones experienced during pregnancy, perimenopause, and then menopause, all of those things can affect the auto, autonomic nervous system and the cardiovascular system, she explains. POTS symptoms may also get worse before or during your period. Now, let me pause there because the part where it says where they test you for it, they put you on a table that tilts. Now that reminds me of a video I've done. One of my previous videos was, I believe, another condition where they test you using a tilting table. So check out my previous videos if you haven't already. POTS is manageable with lifestyle changes and medications. There are certain things you can do to make the condition a little easier to live with, experts say. So here's a breakdown. Trying POTS-friendly exercises. Building strength, particularly in your midsection and legs, is super helpful, per Dr. Bart. Recline aerobic exercise like swimming, rowing, or sitting on a bike really benefits your core and leg muscles, she explains, adding that the recumbent nature of these activities avoids the posture problem. Plus, if you got stronger legs, your body has an easier time pumping blood back up to your brain and heart, Dr. Bart notes. She says that walking can also be a solid exercise choice. Too, just make sure you got the green light from your doc first, especially if you're going to cover long distances alone. Physical therapy can be a helpful alternative if doing these things feels like too much, which is the case for Hudson. Snack on salty foods and sip lots of liquids. Dr. Bart often advises people with POTS to up their sodium intake. Salty snacks are really important in a POTS diet, she notes. This because it might help you keep more water in your bloodstream and get blood to your heart and brain faster. A person with POTS should also be drinking a lot of water, roughly 2 to 2.5 liters per day. Alcohol and caffeine can sometimes make symptoms worse, Dr. Bart adds. Tweak your sleep habits. Lying flat can be really challenging for people with POTS. So we often encourage patients to raise the head of their bed and try to get enough sleep in general, Dr. Bart says. You can consider putting blocks or stilts under your bed frame to raise the top of it. Aim for 6 to 10 inches, keeping the entire bed at an angle. Your body temp might ebb and flow, so sleeping with blankets can easily be removed, and keeping the thermostat as low as possible might also help. And you can also get a bed where they have beds where you can change the position of the beds. Turn to medications. In some cases, a doctor might prescribe a handful of medications to help combat symptoms, including fludrocortisone, which helps you retain salt, pyridostigmine, and beta blockers, which can help with the tachycardia or fluttering heartbeat, and mitodrine, which causes vasoconstriction or tightening of your blood vessels. Hudson, who's now 25, no longer plays softball. She says the only time she's really active is when she's in physical therapy. Even with the medications and lifestyle changes, she says the syndrome still impacts her day to day. However, she acknowledges that her symptoms have become a little more manageable. That's due, she believes, to the fact that her doctors have a better understanding of the condition due to more conversations about it in the medical community and in the media. This might be leading to better treatment or at least some validations that the condition is serious and can have a huge impact on a person's quality of life. That's something both Dr. Bart and Dr. Wilson are particularly adamant about, as the disorder can be incredibly debilitating for a lot of people, Dr. Wilson says. Instead of being a diagnosis of exclusion, POTS should be an inclusion. This should be top priority. Standard of article. So It's a lot of information in this article. I am curious about the snacking on the salty food part and upping sodium intake because that can lead to too much salt can lead to some problems um, as well. But I guess the most important part to that is when they mention drinking a lot of water, because you will, if you're gonna increase your salt intake, you're gonna need to drink more water to flush that out, to balance that out, that the increase in sodium, or else you can have too much sodium in your body can cause problems as well. You know, as well as the exercising part. Focusing on your core exercises and legs exercises, which having a strong core you may find is really helpful in dealing with a lot of issues when it comes to health. Having a strong core is very, very important. You know, going out there and walking and running or jogging, doing a light jog or a power walk if you're able to. You know, you can also run in place. You know, there's a lot of different exercises you do. Like you said, riding a bicycle, or they have a rowing machine where you can sit and row, or you can pedal. Um, you know, so I found that interesting in the article. But if anybody out there, if you having symptoms of what I've read, um, you have some of these syndromes. Have you experienced that? You're sitting down and you go to stand up, and all of a sudden you feel dizzy or lightheaded. You know, you may want to talk to your primary doctor about that. You know, and see what's going on. But it is important to look at to make sure you are looking out for yourself, and you know and maintaining a healthy lifestyle. You know, is really, really important, especially in the times we're living in. There's so much going on in this society. Yesterday I did a video on the breaking news about Donald Trump being found guilty, which I'm sure he's going to appeal it, and that decision or whatever have. There's a lot going on. There's so much going on, and wars and rumors of wars, and then you got to be careful. You got these extremist groups that they may want to, um, you know. Um, do whatever, because of this Donald Trump situation um, yesterday. There's so much going on. So being healthy is at this moment in our life is really, really important. Because you may need to move around or be able to, if you have to, for those who you prep, or for the preppers out there, who have a bug out location, be able to go to your bug out location. And for those who don't have a bug out location, you gotta stay put where you're at to be able to be ready and prepare for whatever. And that's just a part of what I mention every day when every video I do, I release. That's part of how I end my videos, just being prepared and talking about these current events and what's happening. And what goes along with that is maintaining a healthy lifestyle. Is extremely important. If you have loved ones in your circle who aren't healthy, you got to be able to maintain your health and be able to help them and protect them. If you're in a situation like that as well. But maintaining your health is really, really important. But it just goes to show you, and this article is proof of what I just read. Just maintaining maintaining yourself by exercising, working out, doing basic core exercises, even just going out and just taking a walk, watching what you eat, and can offset and really prevent a lot of issues when it comes to your health. Just doing the basics, and this article is proof of that. And know that everybody, they say we're all the same, but we're not all the same. It's like some people, when it comes to being vegan, there are people who've tried being vegan and just their bodies won't allow it. They have to go, their body rejected, they had to go back to eating meat. Some people cannot eat meat. They have to really limit their meat intake or don't eat meat at all because their body just can't handle eating meat. Myself, I'm one where my body just don't just have a really hard time processing the meat, and it just made me hold all the weight, and it didn't matter how much I exercised or how much physical activity I did. It just couldn't lose the weight, So, I had to stop eating meat and don't eat meat, and I'm better off for it. So it's all about studying yourself, and trying different things, see what works. Cut out certain foods and see how and give yourself a week or two, a couple of weeks, see how your body responds, and go from there. You got to study yourself, and make better, healthier decisions for yourself, and remember to work out. You don't have to do nothing extreme. You see a lot of, a lot of people. There's a lot of videos out there. People live in the gym or they work out every day, and it can be a little discouraging, especially for those who you're thinking about working out and you want to begin. You don't know where to start, and so you're looking and you see these people doing these extreme exercises. You don't have to start there. You can start doing basic. I started doing basic exercises, going out for a walk, and building I built from there, and I went from walking a half a mile to a mile, and then I was walking up to 7 miles a day at one point. Then I started with the with the push-ups and the angle push-ups, and until what I'm doing right now, the exercise I'm doing right now. You got to build gradually, and do what you can do, and then you knowing when to push yourself, knowing when to step it up a notch. But again, it all comes from studying yourself, seeing how your body responds, and going from there, and not giving up and not quitting on yourself, and wanting better for yourself, But this is King B News and Views. That's all I got for this video. Remember, love yourself unconditionally. Keep your loved ones close. Talk about what's going on. Have conversations about what's going on with, when it comes to health, current events. Go over your plans. Make sure everybody is doing their part or maintaining doing their part or know what to do. Talk about these things. Keep up with your children. Remember, protect the children, the babies. Children, the babies are under attack, right? Protect our women. Make sure the women are protected. Make sure you look out for each other, watch each other's backs out there, especially in today's time with what we're going through, what we have to deal with, what we may have to deal with. Stay ready, so no matter what circumstances that may come your way, you know how to handle it. You know how to proceed, right? So that's all I have for you. Stay tuned. Shout out to my subscribers. I appreciate each and every one of you. If you are not subscribed, subscribe to this channel. I have a lot of information on this channel. Check out my previous videos. Click the notification, click the bell to all, so you'll be notified every time I drop a video. Leave a comment. Let me know what you think about this video, POTS. You know, check out my previous videos again. I appreciate each and every one of you. Thank you for tuning in to this video. To the next one. Have a great day. Peace.